Good afternoon. I'm back. I understand from Brian that it might appear that I have green halo in my hair, so that's not an effect of my lack of getting my hair done. It's really just part of our production. Anyhow, I will report out that I did test negative for COVID after my quarantine, so that's a positive development, as did my other children, so yay. A reminder that July is Black and Indigenous People of Color Month. And so I do have a couple of slides here, a few where I wanted to just focus in terms of COVID on this population. And so you can see by this first slide, and this is cases by ethnicity in Fresno County. And so this slide, if you look at towards the bottom, it will show you incidents per 100,000. And it shows you that if you notice the other, you think, wow, there's a lot of other people. This is more a reflection that we have not, because of the surge in cases, we have not been able to gather data on a large percentage of our cases. And so that lower line, that turquoise line, blue line, really represents not necessarily something different than the ethnicity shown on the screen, but largely that we don't have that information. But you can see a much higher incidence in our Hispanic population, and so that's a concern. And then the next slide shows you deaths by race and ethnicity, and this was updated through a couple of days ago. Our deaths are actually a little higher, 104, which I'll talk about. And this again shows a high percentage of Hispanic, the largest known with comorbidities. And then the final slide shows you Hispanic and non-Hispanic representing the total population in Fresno County, but also the proportion of COVID deaths is much higher than the population in Fresno County. So when we have health and social inequities, it can have health consequences, as shown by what's happening with COVID. I will say there's a concerted effort through the Department of Public Health right now to do a massive outreach and engagement effort to our Black and Indigenous people of color communities across Fresno County with regards to COVID. So there's some public service messaging going on to ensure that people understand the precautions, and also testing being done out in the rural areas and underserved areas. And so really a big focus, I want you to be aware of that. Also a big focus right now with our farm worker population. Making sure that they understand that the precautions aren't just when they're working, it's also while they're being transported. Oftentimes our farm worker population is transported in large vans with multiple households being combined into one van, and they really need to be wearing their masks during that transport, as well as at home and out in the community. So a lot of efforts ongoing right now to make sure that some of our underserved populations really understand the health risks of COVID and the importance of them following the precautions. All right, on to our COVID update by the numbers. We now have over 15 million cases across the world and almost 620,000 deaths. In the United States, we are just under 4 million cases and just over 140,000 deaths. As we talked about last week, and as is continuing, we have a surge going on across the United States, so I do expect both of these numbers to rise over the coming days and weeks. When you look at California, we've seen an increase of 64,000 cases since last report last week, which is a significant increase over prior weeks. And we now have 7,755 deaths, which is an increase of 668 deaths. And so we're also seeing a slight trend upward in our positive rate from 7.2 to 7.4. That really doesn't tell the whole story, though. Those counties such as ours that are on the watch list have a much higher positivity rate, which I'll talk about in just a second. So the next slide, again, a reminder that because Fresno County now is reporting out only on Tuesdays and Fridays, this slide looks a little different. This is from the state website, and actually it has a more updated number than the Fresno County website. Fresno updated yesterday, but it didn't include yesterday's numbers. This slide does. So we now have 11,412 cases in Fresno County. You can see that graph to the right of that number, which shows a steady upward climb, and we have 104 deaths. In terms of hospitalizations, we have now 296 people hospitalized. If you look at the right hand of your screen, you'll see that a couple of weeks ago, that was 172. Went up to 219 last week, 296 now. So that trended line below the 296 on the graphic just shows that upward trend. 59 now in the ICU, up from 44 last week, up from 42 weeks ago, and now we're down to 44 ICU beds available. And that, from 2 weeks ago, we had 74. So our ICU beds have went down significantly in the last 2 weeks. And a reminder, as cases surge, that will be followed in time by hospitalizations, which will be followed in more time by deaths. So with a continued surge in hospitalizations, until we can get our cases under control, we should expect to see that increase. Our hospitals are already overwhelmed, and so any further increases are going to be hard for our hospitals to manage, not just from a bed capacity issue in terms of physical space, but a reminder also staffing. Just like my family and I experienced with somebody getting COVID and several of us going into quarantine, the same thing is happening to hospital staff. And so someone gets COVID or they get exposed to COVID, and then quite a number of staff have to be out and not able to serve the needs of people in the hospital with and without COVID, and that diminishes the capacity in hospitals as well. That's why it's so critically important that all of us follow the precautions and get this case rate surge under control. The next number just shows our watch list statistics, and remember, this is a slide that really shows you the 14-day rolling trend. So in terms of the rolling trend, we are up in our rolling trend of deaths. We are up in the number tested. We're up in the test positivity. We went from 11.6% last week to 13.6%. And because that's a rolling trend, keep in mind that means our most recent positivity has to be much higher than 13.6 to make our average over the last 2 weeks so much higher than it was a week ago. And we are increasing testing, which is good, but our test capacity is pretty restricted. And so just as an example, it took about 5 days for me to get my test results back. And ideally, you want that to be no more than a day or two. And so the fact that we have limits on the testing supplies and the processing supplies and the hardware that does the test results really limits our ability to get a handle. If you get tested today and you don't get your results until the weekend, unless you quarantine yourself, all of your activity between now and 5 days from now potentially exposes other people. So if we can get test results back quicker and let you know that you are positive, even though you might not be having symptoms, then we can have you isolate sooner. Obviously, if you have symptoms of any type, you should isolate yourself whether you have a test result back or not. And that is the advice given when you go to get tested and you have symptoms. Isolate yourself. And that's what we strongly encourage. All right. So today, what I really wanted to focus on is how are we going to get through this emotionally and mentally. I think I've shared with you in my time having to quarantine at home that it's hard for me to work from home, and emotionally and mentally that was a strain on me. And certainly the stress of knowing that I had a loved one with COVID, that I might get COVID. But it's stressful just to be under lockdown. It's stressful to go to work. It's stressful to stay home. It's stressful to worry about what's going to happen with your kids and school and how will we manage all of that. So we really need to take a pause here and recognize that in order to get through this, we need to take care of ourselves. And what that means is we all need to focus on what we have control over. There's quite a number of things we don't have control over. We don't personally have control over what other people do. We don't have control over how fast a vaccine gets developed. We don't have control over what happens to someone when they're hospitalized. We don't have control over what happens with governor's orders and school closures and openings and all of those things that can add stress. So we really need to focus on what we have control on. And that really hasn't changed through the pandemic, but at different times in the pandemic, it's been more challenging, one versus the other. One thing we all have control over, and is the key to reopening safely, is to follow the precautions and encourage others to do so. This doesn't mean get in a fight with someone if you don't see them wearing their mask, but modeling the behavior that we want to be followed by everyone. Wearing your mask when you're at work, wearing your mask when you're out in the public, wearing your mask when you're around people, even in your home, who you're not familiar with or living with on a day-to-day basis. So if you must get together with people outside your home, you need to wear a mask or keep yourself distant from those other people, and preferably meet outside. Take care of yourself and your loved ones. For each of you, this means a slightly different thing. But taking care of yourself means physically taking care of yourself, mentally taking care of yourself, taking breaks throughout the day, whether, when you're working, taking time off as needed. I'm going to have next week off. This will be my second week off in a while, and I really need it. I had several weeks planned for vacation over the last several months that I didn't take, and so I'm trying to keep up with my normal routine as much as possible. But when you take a break, whether it's a break during your daytime or a break, you really need to clear your mind. And what that means is we can't focus on data. We can't focus on social media and the news. We can't focus on the statistics. We need to take a break. Don't pick up your phone. Don't look at your social media. Go outside, exercise, take a walk, play a game, read a book. Do the things that you can enjoy doing that don't involve a focus on COVID. This has been hard for me as well. At different times during the pandemic, there's certain websites that I've focused on, the statistics. Just to keep up with this report, I have to look at all of those things regularly anyways. So it's really helpful to me when I'm not at work not to do that, and I encourage you to do the same. We've had a lot of weekly emails going out that really focus on meditation and mindfulness, and we really encourage everyone to really look into that. Dip your toe in that water if meditation or mindfulness isn't something that you already do. It can be very, very helpful to you as you cope with this. And going to counseling. I've had a couple of my family members start counseling during the pandemic, and it's really helping them with issues they had prior, but also issues that have been magnified by the pandemic. And so don't be afraid. We have the employee assistance program that's available to you, as well as services that you can receive through your health insurance. And so if you at any time feel like that's something that you need, we need to be a model for what we're doing for the people we serve, and that is encouraging ourselves to take advantage of the resources available to us and recognizing that we're not immune. There's no exemptions here. Just because we're frontline workers, just because we're healthcare providers, we have our own issues to deal with. And so you need to take care of yourself. And I really want to emphasize that and know that you have our support to take care of yourself. Okay, yay, it's time for some awards. So what I'm going to ask you, we're going to do some awards. So if you have any questions while I'm doing the awards, if you could type them into chat. Then when we're done with the awards, I'll answer those questions. So what are these awards? Well, if you'll recall, a couple of months ago, we announced that we were doing Guiding Principles of Care Delivery Awards, where you could nominate one of your coworkers who really models or exemplifies one of those guiding principles. And we had quite a few individuals nominated. And each of them received a certificate, the people who were nominated, that we signed and was sent to them. And then they're each going to also receive a small little swag bag of some Each Mind Matters. And then we're going to do a drawing today with some gift cards. So I'm going to do, it's on TV, so you know I'm not cheating. I'll look away. Okay, and this is for a $5 Starbucks card, and it is going to Dr. Sadid Jawad. All right, Dr. Jawad gets a $5 gift card. Woo! We got some clapping offline here. Okay, again, let me mix it up. Let me look away. Another $5 gift card. All right, this one goes to Mark Winslow. Mark Winslow. Woo! All right, another $5 gift card. And this one goes to Christy Barnett. Christy Barnett gets a $5 Starbucks gift card. All right, we have another gift card for $5 to Baltimore Gonzalez. Baltimore will help you with rap and many other ways to calm your mind down. All right, one more $5 Starbucks gift card, and this goes to Bai. I'm not going to. Bai's last name is very difficult to pronounce. I have a difficult name to pronounce, so I think most of us know Bai, who works in human resources. All right. Next up, we have a $10 Starbucks gift card. Little note, I'm going up in value. All right, this goes to Kira Quant. Kira Quant gets the $10 gift card. Now we have a $15 Starbucks gift card. Hopefully you like coffee. All right, this one goes to Michael Stacer. Michael, all right. And then we have a $25 Cold Stone Creamery. They do takeout. So Cold Stone Creamery. And that goes to Ki Sun. Ki Sun. Yay. All right, $25 Starbucks gift card. And this one goes to Beth Schneider. Beth gets a $25 Starbucks gift card. Now we have a $25 Red Robin, another takeout right now. And this goes to Maria Imperatus. Maria, all right. And then this one is an Amazon $25 gift card. And while I'm pulling this one out, I will tell you that all of these gift cards were donated by myself, Susan, and Marianne. No public funds were used in these awards. All right, Estella Lopez gets the Amazon gift card. All right, and then for the grand finale, we have two $25 gift cards that will be awarded as a $50 gift card. And this will go to Rita Mejia. Rita Mejia gets the $50 of Target gift cards. So I hope you enjoyed hearing about these awards, and I think you can see that it's not just clinical folks who can model the guiding principles of care delivery. And more importantly, we're going to be doing this probably at least once a year, if not more often. And so if you want to pull out those guiding principles of care delivery and read them and understand how would you embody those guiding principles, because you too could get a gift certificate, a swag bag, and maybe a gift card. And so we really want our whole department to be focused on following those guiding principles, and this is one way that we can remind folks and honor those who really do exemplify them. So thank you for those of you who nominated our examples of really living and breathing the guiding principles, and congratulations to all of you who were nominated. We're really proud of you. Okay, let's see if we have any questions. I don't see any questions right now. Maybe I'm getting so good at this that I'm answering all of your questions. Oh, here we go. If there are positive instances of COVID within our department and you have come in contact with a positive individual, will you be notified? Yes, you will. So if and when we have anybody who's positive in the department, we have a protocol that the county has developed that our department follows, and you would be notified and told that you were exposed to someone who tested positive for COVID, and that would and recommendations would be given to you based on public health recommendations based on the exposure. And so we follow the contact tracing principles, and you would be notified. And this is coworkers, cleaning staff, etc. Yes, anyone who we are aware of who tests positive. Now, it is possible someone could test positive that we are not made aware of, but they would be, you know, when I might have shared this previously, but when I had a family member who tested positive, when they're doing the contact tracing, if they get to you, but really when you test positive, you are bound by the isolation orders. And it's an order. It's signed by Dr. Vora saying you need to isolate for 10 days and what that means. And then if you were exposed, and remember, exposure in terms of quarantine, when you're required to quarantine, means that you were within 6 feet for more than 15 minutes without a mask. And so individuals from public health make the determination of who is quarantined, needs to be quarantined, and that could be everyone in your household who came in contact with that person if it's felt that it would be difficult to determine that 6 feet in 15 minutes. And so then you're under orders for quarantine as well. So there is a process. It's a fairly formal process that the Public Health Department goes through. All right, I don't see any other questions. Again, I just want to remind everyone, please take care of yourself. We're no good if we can't take care of ourselves. It's very difficult to support other people when we ourselves need support. And so you have my permission, in fact, my expectation that you take care of yourself. And don't forget the guiding principles of care delivery. When we live those guiding principles, we're taking care of ourselves, the people we serve, and the people we work with. So thank you.